Welcome, everyone, and thank you for being here today for this important discussion on overcoming painful penetration. I want to acknowledge that if you're here, it's likely because you or someone you care about has been struggling with pain, frustration, or even isolation around intimacy. I want you to know you are not alone. Pain with penetration can feel deeply personal, and for so many people, it's something they've been silent about for years, sometimes decades. But here in this space, we are breaking that silence. This is a space for understanding, support, and solutions. Throughout this session, I encourage you to listen to your body. If something resonates, take a note of it. If a question arises, jot it down. Your experience is valid, and your concerns deserve answers. Together, we are going to explore what genital pelvic pain penetration disorder, or GPPPD, is, why it happens, and most importantly, how we treat it so that penetration can feel safe, comfortable, and even pleasurable again. Let's get started. Genital pelvic pain penetration disorder, or GPPPD, is a medical condition that causes pain, tightness, or both, making penetration difficult or even impossible. For some people, this means pain during intercourse. For others, it may be difficulty using tampons or undergoing a pelvic exam. Some may experience discomfort even with very light touch. Now, let's be clear about something important. This is a real condition. It's not in your head, and you are not overreacting. Pain with penetration is not normal, and more importantly, it is treatable. The key to healing is understanding what's happening in your body, and that's exactly what we are going to do together today. GPPPD is not just one condition. It's an umbrella term for several different disorders that affect penetration. First, there's dyspareunia, which is a persistent or recurrent pain during or after penetration. Some people feel pain only at the entrance, while others experience discomfort deeper into the pelvis. This can be caused by infections or scar tissue, hormonal changes, or pelvic muscle dysfunction. Then there's vaginismus, which is when the pelvic floor muscles tighten involuntarily, as if the body is reflexively protecting itself from penetration. This makes intercourse, tampon use, or even gynecological exams painful or impossible. And finally, there's vulvodynia, which is a chronic pain in the vulva that lasts more than 3 months. This pain can feel like burning, stinging, or rawness, and it may be constant or triggered by touch. Each of these conditions affects the body differently, but they all have one thing in common. They are treatable. And today, we are focusing specifically on vaginismus because it is one of the most common causes of painful penetration. Vaginismus is when the pelvic floor muscles tighten involuntarily, and that creates pain or resistance to penetration. It's important to recognize this is a reflex. You are not doing this on purpose. It is not a mental block, and it is not about trying harder. Think of it like an eye blink. If something gets too close to your eye, your body automatically closes your eyelid to protect itself. With vaginismus, your body does the exact same thing, but with your pelvic muscles. It reacts by clenching when penetration is even anticipated. And just as we can retrain our body's reflexes, we can also retrain the pelvic muscles to relax. And that is the foundation of treatment. Not everyone experiences vaginismus in the same way. That's why treatment should be tailored to your specific experience. Some people have primary vaginismus, which means that penetration has always been painful or impossible since the very first attempt, whether this was with a tampon, a pelvic exam, or intercourse. Others have secondary vaginismus, which develops later in life after a period of painful penetration. It can be triggered by an infection, childbirth, trauma, or even menopause. For some, vaginismus affects all forms of penetration: tampons, exams, intercourse, and this is known as global vaginismus. Others experience situational vaginismus, which is penetration that is only painful in certain scenarios. For example, intercourse is painful, but tampon use is fine. Understanding your type of vaginismus is a really important step toward healing because it helps tailor the right treatment plan for you. Vaginismus follows a cycle, one that reinforces itself over time. It often begins with fear or anxiety about penetration. Maybe it's been painful in the past, or maybe you've absorbed some messages that sex is supposed to hurt. In response, your pelvic muscles tighten involuntarily, and this is your body's way of trying to protect you. When penetration is attempted, the tight muscles make it painful, confirming your very fear. And the more this happens, the more your body anticipates pain and the tighter the muscles become. This is how the cycle of vaginismus forms. But here's the key. The cycle can be broken. Just as your body has learned to tighten in response to penetration, it can also learn to relax through treatment. That is what we're going to focus on next. This image visually demonstrates what happens in the body with vaginismus. On the left, we see a normal vaginal opening where the muscles are relaxed and flexible. This allows for comfortable penetration. On the right, we see vaginismus in action. The pelvic floor muscles at the vaginal entrance are clenched really tight, creating a smaller, more rigid opening. This is an automatic response from the nervous system. It is not your fault and it is not permanent. The same way the body can learn to tense, it can also learn to relax and release. And that's what treatment is all about. The next big question is, why does this happen? Vaginismus is not caused by just one thing. It's a combination of factors, and they all interact with each other. Some people develop vaginismus after a painful experience, like a series of urinary tract infections or an uncomfortable first attempt at penetration. Others have anxiety or learned beliefs about sex that make their body react defensively. And for others, it's a neurological response, a pain reflex that has become overactive. And for others, it's influenced by social messages, like growing up in an environment where sex was considered shameful or a taboo. The important takeaway here is that because vaginismus has multiple causes, it also has multiple paths to healing. Understanding the root cause allows us to address them directly. So let's break them down one by one. One of the most common contributors to vaginismus is physical factors. Your pelvic floor muscles play a major role in penetration. If these muscles are too tight, if they're uncoordinated or overreactive, they can create an involuntary barrier to penetration. Other physical causes can include hormonal changes, such as after childbirth or menopause, which can then lead to vaginal dryness and increased pain sensitivity. Past infections like UTIs or yeast infections can also train the body to associate penetration with pain, which reinforces muscle tightness. Additionally, medical conditions like endometriosis or irritable bowel syndrome, among others, can contribute to pelvic pain and muscle tension. If penetration has been painful in the past, your body remembers. It instinctually tightens up to prevent further discomfort. But the good news is, just as the body can learn to brace for pain, it can also learn to relax. Psychological factors play a huge role in vaginismus. Many people with vaginismus develop fear or anxiety around penetration. If you expect pain, your body instinctively tightens to protect itself. For some, past sexual trauma or distressing experiences can make the body react with involuntary muscle contractions. Generalized stress or anxiety can also contribute, as the pelvic floor muscles are deeply connected to our overall nervous system. And of course, relationship factors can also influence vaginismus. If there is emotional disconnection, pressure, or unresolved tension, the body may react with avoidance and pain. The important thing to understand is that the body is not betraying you. It is simply responding in the way it has learned to keep you safe. And with treatment, it can learn a new, more relaxed response. We don't often think about it, but our culture and upbringing can have a profound impact on how we experience our bodies and intimacy. Many people with vaginismus were raised in environments where sex was never discussed, leaving them with uncertainty, fear, or guilt about penetration. Some grew up with strict religious or cultural beliefs that framed sex as something to fear or avoid until marriage, making the body instinctively resist penetration later on. And for many, lack of sexual education meant that they were never taught what to expect, or that sex is supposed to be pleasurable, never painful. By unlearning harmful messages and replacing them with accurate, compassionate knowledge, we can help the body feel safe and relaxed once again. Finally, vaginismus is also linked to neurological factors, specifically how the nervous system processes pain and muscle control. For some, penetration has been painful in the past and their nervous system has memorized that pain. This leads to an automatic muscle tightening response, just like how our body jerks away from something hot before we can even think about it. Others have a more sensitive nervous system that amplifies pain signals, making even mild discomfort feel overwhelming. The key here is that this response is not permanent. The same way the body learned to retract with pain, it can be retrained to relax and feel safe once again. And that's exactly what treatment focuses on. Vaginismus is rarely caused by just one thing. Instead, it's a combination of factors that reinforce each other. For example, if someone experiences pain during their first attempted penetration, physical, they may begin to fear penetration, psychological, which causes muscle tightening, neurological, making them avoid penetration altogether, social. Or if someone was raised in a culture where sex was considered shameful, social, they may feel anxiety about penetration, psychological, leading to muscle tension, neurological, and painful penetration, physical. This is why treatment must be comprehensive, addressing all contributing factors at once. And the good news is we have highly effective ways to do this. So let's talk about them. Here's what I want you to remember. Vaginismus is highly treatable. Many people who once thought that they would never experience pain-free penetration have gone on to heal and regain their confidence. The most effective treatments include education, which is understanding what's happening in your body, which helps to reduce fear. Pelvic floor therapy is learning to consciously relax the muscles. Desensitization is gradual exposure to penetration in a controlled, pain-free way. Cognitive behavioral therapy is addressing fear, anxiety, and emotional triggers. With the right approach, healing is absolutely possible. Let's talk about how to get you there. Shelby grew up in a home where conversations about sexual health did not happen. She had no idea what was normal or what to expect. When she experienced a painful UTI in college, she felt too embarrassed to seek treatment right away. Later, when she tried using tampons, it was painful, and she blamed herself. Over time, fear and avoidance became her norm. She stopped trying to use tampons, she avoided relationships, and she felt completely isolated. Shelby's story is far too common, but what changed for Shelby and what can change for you is learning that pain with penetration is not permanent. When she finally sought help, she realized there were real solutions that could help her reclaim both comfort and confidence. Annie's vaginismus journey began with a painful pelvic exam. The experience left her anxious about future exams, and before she knew it, she started avoiding the doctors altogether. When she later tried to engage in intimacy for the first time, her body clenched, tightened, and braced against penetration. The pain confirmed her fears, and she became stuck in a frustrating cycle of fear, tension, and avoidance. Annie's story highlights a truth that many people experience. A single painful event can create a lasting muscle reflex. But just as the body learned to protect itself, it can learn to release and relax again. And that's exactly what treatment focuses on. Claire's experience with vaginismus was deeply tied to her past. As a survivor of childhood sexual abuse, her relationship with her body was shaped by trauma. As she grew older, any attempt at intimacy triggered severe pain and muscle tightening. It wasn't just physical. It brought back memories she wanted to forget. She felt trapped, as though her past was still controlling her. The distress left her feeling isolated and uncertain about how to move forward. Claire's story is a reminder that vaginismus is not just a physical condition. It is a protective response deeply connected to emotions and past experiences. But the body can unlearn this response with the right treatment. Through trauma-informed therapy, pelvic floor treatment, and gradual desensitization, Claire began to heal. She rebuilt trust with her body, reduced the pain, and reclaimed a sense of control over her intimacy. If there's one key message I want you to take away, it's this. Vaginismus is treatable. It's easy to feel discouraged, especially if you've been struggling with pain for years. You might have been told that it's just in your head or that you need to push through it. None of that is true. This is a medical condition with real solutions. Many people who once thought that they could never experience pain-free intimacy have gone on to heal and reclaim their confidence. Treatment does not happen overnight, but with the right approach, you can retrain your body, you can reduce the pain, and you will move forward with the self-assuredness that you deserve. Let's talk about what that process looks like. Healing from vaginismus requires a comprehensive approach that addresses both the physical and the emotional aspects of the condition. There are 4 key pillars of treatment. 1, education, understanding your body, breaking harmful myths, and learning that pain is not permanent. 2, pelvic floor therapy, working with a specialist to release muscle tension and improve coordination. Number 3, desensitization, gradually retraining the body to feel safe and relaxed with penetration. 4, cognitive behavioral behavioral therapy, known as CBT, addressing fear, anxiety, and negative thought patterns that contribute to the pain. Each of these approaches supports the other. For example, learning about your condition, education, helps reduce fear, cognitive behavioral therapy, which makes pelvic floor therapy more effective. By taking small, consistent steps in these areas, healing is absolutely possible. Let's take a deeper dive into each one. The first step in healing is understanding what's happening in your body. Many people with vaginismus blame themselves or assume the pain will always be there. But once you learn that vaginismus is a reflex your body has developed as a protective response, you can begin to approach healing with confidence. Education helps in two major ways. One, learning how the body's reflexes work. When penetration has been painful in the past, the pelvic muscles automatically tighten to protect you from that discomfort. This is an involuntary reaction and not something you are choosing. Two, realizing the condition is treatable. Once you understand that these reflexes can be retrained, you can begin to replace fear with hope and practical solutions. Right now, just by learning about vaginismus, you're already taking the first step toward healing. Education reduces fear, and when fear decreases, the body can finally relax. One of the most effective treatments for vaginismus is pelvic floor therapy. A pelvic floor therapist is a specialist who works with the muscles that control penetration. In therapy, they will, 1, assess muscle tension and coordination. Are the pelvic muscles that are overly tight? Do they struggle to relax? Guide you through gentle exercises, stretches, breathing techniques, and relaxation strategies. And 3, use hands-on techniques. If you're comfortable, this may include internal therapy to release tension. Many people worry that pelvic floor therapy will be painful, but therapists work at your pace. Sessions are always based on your comfort level, and they focus on teaching your body how to relax. This process helps break the cycle of tension and pain, making penetration easier and more comfortable over time. Pelvic floor therapy is a specialized treatment that focuses on retraining the pelvic muscles to relax and function properly. Many people with vaginismus have never consciously controlled these muscles before, so learning how to release tension and improve coordination is an essential part of recovery. Therapy can include a variety of approaches, including breathing techniques to relax the pelvic floor and gentle exercises to improve flexibility and control. Hands-on treatment from a trained specialist to release the muscle tightness. If you've been avoiding treatment because you're worried it all will be so uncomfortable, know that pelvic floor therapy is tailored to your needs. It is designed to empower you, helping you regain control over your body. The first step in pelvic floor therapy is a muscle assessment to identify what's happening in your body. A trained therapist will check for tightness. Are the pelvic muscles clenching involuntarily? Trigger points. Are there certain areas of tension and discomfort? Coordination. Are the muscles able to relax and contract properly? This assessment helps create a personalized treatment plan based on your unique needs. Everyone's experience with vaginismus is different, and understanding how your body is responding is the key to developing an effective approach to healing. After the assessment, the therapist may use manual therapy techniques to help release tension and improve your muscle function. This can involve external techniques, gentle pressure or massage around the hips, abdomen, or inner thigh. Internal techniques, if and when you're comfortable, the therapist may use gloved hands to apply light pressure to the pelvic floor muscles internally. Internal therapy may sound intimidating, but it is always done at your pace, with your explicit consent, with full control over the process. When combined with at-home exercises and relaxation techniques, manual therapy can significantly reduce pain and improve confidence in your body. Desensitization is a gentle, gradual process that teaches the body that penetration can be safe. Many people with vaginismus develop an automatic fear response to penetration, which just causes their muscles to tighten. Desensitization helps retrain the nervous system to respond with ease instead of fear. This process works by starting small. Often, desensitization begins with very light touch or the smallest dilator paired with deep breathing, progressing at your own pace. As your body becomes more comfortable, you slowly work up to larger dilators or other forms of penetration. The key to success is patience and consistency. This isn't about forcing anything. It's about teaching your body that penetration can be safe, comfortable, and eventually enjoyable. One of the most effective tools in retraining the body's response to penetration is dilator therapy. Dilators are small medical-grade devices that come in a range of sizes. The goal is to start with the smallest size and then gradually work up, allowing the pelvic muscles to adapt slowly and comfortably. This process is about gently introducing penetration in a controlled, pain-free way that helps the muscles relax over time. For the best results, dilator therapy is paired with deep breathing techniques and exercises to signal relaxation to the nervous system, mindfulness techniques to shift focus away from fear, and a slow, patient approach that respects your body's pace. This is not about forcing anything. It's about giving your body time it needs to unlearn its protective reflexes. With practice, the muscles retrain themselves to remain relaxed, making penetration easier and pain-free. Vaginismus isn't just about muscle tightness. It's also about how the brain perceives penetration. Cognitive behavioral therapy, or CBT, is a proven psychological approach that helps people change thought patterns related to pain, fear, and intimacy. Many people with vaginismus have developed very deep-seated fears, anxieties, and negative beliefs about penetration. These can be the result of past pain, cultural messages, or experiences with shame around sexuality. CBT helps in several ways: identifying fears related to penetration, challenging negative beliefs that reinforce pain and avoidance, and building confidence in the body's ability to heal. By reframing the way you think about penetration, CBT works alongside physical therapy to make the healing process smoother and more effective. CBT is not just about talking. It includes practical tools that help reshape your relationship with penetration. Some of the most effective techniques include cognitive restructuring, challenging negative thoughts and replacing them with supportive, evidence-based beliefs; exposure therapy, gradually confronting the fear of penetration in safe, controlled steps; behavioral experiments, testing new behaviors to learn that penetration does not have to result in pain; relaxation and mindfulness, managing anxiety responses to help the body feel at ease; thought journaling, identifying and tracking negative thought patterns that contribute to avoidance; sensate-focused exercises. This encourages non-penetrative intimacy to rebuild comfort within the context of your romantic partnership; self-compassion techniques, understanding that healing takes time and progress happens in small, steady steps. CBT helps rewire fear-based reactions and replaces them with a sense of safety and control. With practice, it can dramatically reduce the anxiety and avoidance behaviors that contribute to vaginismus. Healing from vaginismus is a journey, one that combines education, pelvic floor therapy, desensitization, and CBT. These pieces work together to address both the physical and emotional aspects of painful penetration. The timeline for healing is different for everybody, but the most important factors for success are patience and consistency. Every single step, whether it's learning about your body, working with a therapist, practicing relaxation techniques, or using dialectic, moves you forward. The key is to create a treatment plan that feels manageable for you, empowering, and tailored to your needs. Healing is not about perfection. It's about steady progress toward comfort and confidence. Sophia has always struggled with penetration. She found tampon use difficult, avoided routine pelvic exams, and feared intimacy due to the expectation of pain. When she entered a committed relationship, she discovered that intercourse was impossible. The severe pain and involuntary muscle tightening made penetration completely unimaginable. Frustrated, confused, and ashamed, she began to withdraw from her partner and blame herself. Like many others with vaginismus, she felt isolated, uncertain about what was happening, and unsure where to seek help. But Sophia's story didn't end there. She took a step that would change everything. She reached out for help. After months of struggling alone, Sophia finally confided in a trusted friend. Encouraged by the support, she scheduled a doctor's visit and was diagnosed with GPPPD. Her doctor reassured her that her body was not broken, the condition was treatable, and she was not alone. Sophia was referred to a pelvic health specialist where she learned why her body was reacting protectively. Understanding that vaginismus was a reflex and not a personal failure was the first step toward healing, and for the very first time, she had hope and a plan to move forward. Sophia's recovery journey began with education. She learned that her symptoms were an automatic response from her nervous system, not something she was choosing or causing. She started working with a pelvic floor therapist who guided her through relaxation exercise to ease muscle tension, gentle muscle release techniques to improve flexibility, a step-by-step approach to desensitization with dilators. And alongside physical therapy, she engaged in CBT therapy sessions where she addressed her fears around penetration, reframed her beliefs about pain and intimacy, and developed confidence in her ability to heal. With consistent practice and emotional support, Sophia began to see real progress. After months of dedicated effort, Sophia's body and mind began to heal. She regained comfort with her body, and intimacy became pain-free. But her transformation was more than physical, it was emotional. She rebuilt confidence in her ability to experience pleasure. She strengthened her relationship with her partner, and she developed a newfound trust in her body's resilience. What once seemed impossible became a reality. Sophia had overcome vaginismus. Her story proves that healing is not just about reducing pain. It is about reclaiming joy, intimacy, and self-trust. If there is one message I want you to take away from this, it is that recovery is absolutely possible. It may take time and it may take patience, but every single step forward, no matter how small, moves you closer to comfort and joy and confidence in your sexuality and your sensuality. Painful penetration does not have to be a lifelong struggle. Through education, therapy, gradual desensitization, you can retrain your body and your mind. Your journey is valid, your progress is real, and healing is within reach.